The craniocervical flexion test is a test of the activation of the deep neck flexors, the longus capitis, in synergy with the longus colli. It's a low-load test and performed in the supine position. What we've got to look at is that the craniocervical and cervical regions are in a neutral position. So for the craniocervical region to be in a neutral position, we look for a straight line between the forehead and the chin. And for the neck, we have an imaginary line that bisects the neck, and we see that that is parallel to the bed. Now in some patients, they may lie in extension, and often due to maybe an increase in the thoracic kyphosis. And then some people also have a big space between the back of the neck and the bed. If that space is too big, we've got to inflate the biofeedback too much, and that makes the test less accurate. So in those cases, we can use a rolled towel to fill the space between the back of the neck and the bed, and we can also have towel underneath their head to take them out of any extended position. Now in this case, the subject is in a good neutral position without using a towel. So the second phase of setting up is to insert the biofeedback. Now with the biofeedback, we make sure that it's folded in three, and in folding it in three, make sure the bag is folded back on itself so that this centre part, without a clip, is caught in the middle. Now the bag needs to be folded into three so that it'll fit nicely behind the neck. So we insert it behind the neck and then draw it up so that it's positioned suboccipitally. We'll then inflate the bag because we want the baseline to be 20. Now in this situation, because of the folded bag, the air's got to go around corners, and so we can help distribute the air and get a stable baseline before we start by pushing on the bag to distribute the pressure. And you may have to do this 2 or 3 times. Okay, so once we're approximately right, we'll then teach the patient what to do in the test. So the test is in 2 phases. So the first phase is that we're going to test the activation capacity of the deep neck flexors by getting the patient to do a craniocervical flexion action 5 times to increasing inner range positions. The second phase of the test is to test their endurance. So in teaching the patient, the best instruction to give is to say to the patient, feel the back of your head slide up the bed as you nod your chin. Excellent. Feel it again, slide and nod. Feel the slide and nod. Feel the slide and nod. That's good. Now, checking that your baseline is stable just below 20, position the biofeedback just above the chin. Now remember, the biofeedback is for the patient, not the therapist. What the therapist must analyse is the movement of rotation, and what we want to see with each progressive level of the test is an increased range of craniocervical flexion. So if we let the patient have a practice run, so just nod to 22, that's it, and let go. Feel the back of your head slide as you nod to 24, and I'm watching that rotation and looking for a progressive range of rotation. So now slide and nod to 26 and relax. Slide and nod to 28. I'm also observing for any unwanted activity in the sternocleidomastoid, and once more to 30. That's excellent. So this is a person without trouble in their deep neck flexors, so that you can see they can quite easily do the 5 phases of the test. So let's just look at it once more and watch to see that increasing range of rotation each time they nod. So feel the slide and nod gently to 22. Excellent. Feel the slide and nod to 24. Not too fast. Feel the slide and nod to 26. And watch for that increasing range of craniocervical flexion. Feel the slide and nod to 28 and relax. feel the slide and nod to 30. Now some patients you'll find can't perform the test, so that they'll find after 22 or 24 it's too difficult. Others will use a cheating strategy, which is commonly retraction. And what you'll see then is that rather than get that increasing range each time they nod, you'll see that you start getting similar range and they retract. So let's just do an experiment here. So slide and nod to 22 and relax. Slide and nod to 24 and you're seeing the good action. Now slide and nod to 26. Slide and nod proper and let go. Now let's say that she couldn't do that, so she reverted to a more retraction action. So let's try to do it and let go. Now let's do a nice one. Slide and nod to 26. Excellent. Now let's see a substitution strategy, which is the retraction. Okay, once more. Slide and nod to 26, the correct way. Now retract. And so that's what you'll see, that they'll lose that craniocervical flexion and they'll start that retraction action. Now, if the patient can perform the movement, we can then go to the second part of the test. And phase 2 of the test is looking at their holding capacity. Now, in research, we do 10 by 10 second holds at each level to assess what their endurance capacity is like. In the clinical situation, that takes too long. So we take a shortcut and just get them to do 2 or 3 contractions for about 5 seconds to see if they can manage. So slide and nod to 22 and hold it, hold it, hold it and let go. Once more, slide and nod to 22 and hold it, hold it, hold it and let go. One more, slide to 22 and hold it, hold it, hold it and let go. And so she's obviously having no problem, so let's quickly progress to 24. So slide and nod and hold it, hold it, hold it and let go. Slide and nod. And what you might find is the patient, now that the dial drops down, or that they start that almost fatigue tremor that they can't hold it. And so you stop testing the holding capacity when they start to fail, and that will inform us that you'll start training on the level below. So if they failed at 24, we can start training them on 22. So under normal circumstances, in the first stage of the test, where we're testing the activation, normal patients can usually do 26, 28, and some of them can go up to 30 with no problem. Most of your neck pain patients can't do more than 22 or 24. And again, you'll find in the clinic that most of your neck pain patients really start to fail on holding at 24 or 26, and some may even fail on 22.